Hi, I'm Richard Myers, presidential candidate for the Free Liberty Party. As current governor of Arizona, I would like to thank all my supporters at home and all my fellow Americans for this opportunity and for the support I have received upon this point. Throughout my life, I have set out to do what I can to help my fellow Americans. Before beginning my role as governor, I worked as a personal injury lawyer. I am now in my 4th term as governor and would like to continue to serve this nation in presidential office. I have developed a sense of what the people of this nation want for themselves, and furthermore, what is best for the country in order to keep it economically and politically strong. With your help, I can make this nation better with healthy changes to the country as a whole. As a proud American, I feel strongly about protecting my nation and my people. Homeland security should be the main focus in this war on terror. The tragic events of September 11th left me a widower and a single father to my own twin daughters. For all of us, the calamitous day caused great pain, but it also awakened great pride. We should use the patriotism positively by working to protect our airports, seaports, and borders. Our soldiers no longer need to be protecting us in Iraq. They need to be protecting us at home. Sending our soldiers over there has created many unnecessary and unavoidable problems. Spending so much time and money in Iraq has been detrimental to the United States. We never need to forget the attacks of September 11th on the World Trade Center and the Pentagon. But after losing my wife in the attack on the World Trade Center, I realized that the most important things are to protect our seaports, airports, and borders. Money that could be spent to do these very things is instead being used to spend money on troops in Iraq. Originally, our invasion of Iraq on March 20th, 2003 was an attack on bin Laden. But that invasion has clearly gone too far. We have been in Iraq too long and spent too much money in this war on terror. About $900 billion of U.S. taxpayers' funds have been spent or approved for spending through September 10, 2010. As of October 2009, our average monthly spending in Iraq was $7.3 billion. The average cost of deploying one soldier to Iraq for 1 year is about $390,000. As of November 30th, 2009, 1,115,000 U.S. troops were deployed to Iraq, and all other countries have withdrawn their troops, and we need to do the same thing. Not only have American lives been destroyed, but many innocent Iraqi lives have been destroyed as well. Thousands of civilians have been killed in our war on terror, and we have pushed over 4 million Iraqis from their homes, and 2 million have left the country entirely. The death toll has been tremendous throughout the past 7 years. In the first month alone, 65 soldiers have been killed, and 202 were wounded as well. Over the past 7 years, 4,282 soldiers have been named dead, and 30,182 soldiers have been wounded. Of the soldiers deployed, 30% developed serious mental issues within the 3 to 4 months of returning home. It's time to begin ending this nightmare and bringing our soldiers home. Our education system is also in need of alterations. Many students in America are forced to attend failing schools as a result of school district lines. Children with high potential who may flourish in a better school environment are forced to attend schools that consistently receive test scores below expectations. Parents should have the opportunity to send their children to the schools with the best programs and teachers for their children. Federal dollars should be spent to create competition among public schools and raise test scores. Voucher programs should be started creating more competition, and students should attend any school that will meet their specific needs, regardless of school districts. In the current elementary and secondary schooling system, states draw district lines according to population. School curriculum, funding, teaching, and other policies are set through locally elected school boards with jurisdiction over school districts. Students are told which school they will attend, and it is nearly impossible in many states to get approved to attend a school outside of your district. If a student does not wish to attend the school in their district, the only other options are private school or homeschooling. For many families, funds for private schooling just don't exist, and their children are forced to attend failing schools. Because curriculum in the United States vary widely from district to district, educations vary from state to state. Not only do schools offer a range of topics and quality, but some private schools often include religious classes as mandatory attendance. This has produced several arguments over the standardization of curriculum and to what degree. Wealthy parents have a choice for where they send their children, and families with low income should have the same opportunity using voucher programs funded by the federal government. In the system, parents who choose a private school in the area will be given a voucher. This is given to the family to pay the cost of tuition at a private school. The program was developed due to the failure of public schools in many urban areas of the country. Competition has been the key to success in many areas of business, and the same idea can be applied to education to create more efficiency and higher test scores. Currently, those parents who send their kids to private schools essentially pay twice. Their taxes pay for public schools, and their children don't even attend, and their tuition money pays for private schooling. Regardless of where their children attend school, all parents must pay taxes. Their taxes are used to fund public school because private schools charge tuition. Those parents that send their children to private schools are actually paying for two educations. This issue can easily be solved using school voucher programs. Unlike education, the healthcare system is not in need of drastic changes. Creating a universal healthcare system would be detrimental to the nation's economy. Healthcare should be left to the individual, not to the government. The private sector can bring more efficiency out of every dollar in a way that a government office may not be able to. The proposed free healthcare would be anything but free. Expenses for healthcare would have to be funded with increases of taxes or decreased funding in other areas such as education or border protection. The elimination of monthly health insurance premiums would cancel out increases in tax. If universal healthcare will take money away for potential disease research or education, you must ask yourself, what is really better for our nation? Government healthcare will result in less patient flexibility. In theory, if the government paid for everything under one plan, you could go to any doctor. However, controls will have been put on healthcare to keep costs from exploding. How will decisions be made about elective surgeries? Who will decide what a good reason for an elective surgery is? Compromises on issues like these will create controls that will limit patients' options and create much confusion. Universal healthcare could potentially drive away future doctors and medical staff. Private practice options and flexibility attract students to a professional career. Under a universal healthcare system, doctors who are best in their field will likely be paid with the same as doctors who provide poor patient care. This will likely keep potential doctors from wanting to go through years of medical school and residency. Patients may also be subjected to extremely long waits for healthcare. In countries with universal healthcare already in place, some patients are forced to wait months or years for healthcare. In the United States, we often can't receive that care immediately. Limited financial and human resources will force the government to decide who gets the care and who will wait. That decision needs to be made by the individual, not by the government. Government benefits typically end up being taken as rights by the public. Once in place, it would be nearly impossible to remove the system later. The problems universal health care will cause will be permanent and detrimental to our already suffering economy. Upon my nomination for president, I began the search for a strong leader who shared my views on these issues. I am pleased to have a vice presidential candidate for the Free Liberty Party, Dan Ube Johnson, as my running mate. As Senator of Mississippi, Dan Ube has worked hard to create awareness for school voucher programs. Together, we can improve test scores across the nation, and together we will work to decrease the nation's debt. Thank you so much for your support and for your vote. Have a good day.